Hi guys, it's Dana from Peaceful Living. So today we're going to talk a little bit about emotional avoidance and EMDR therapy. So usually you can ask somebody, how do you feel about emotions, or do you avoid your emotions? And most people will say, yep, 100%, I don't want to talk about that. It's just, I think, the society that we live in as well. We're told, don't be such a big baby. It's not that big of a deal. It's just kind of normal, and I hate to use that word, but normal to invalidate emotions in our world, especially for first responders, for military professionals. But the focus of this video especially is for childhood trauma, since that's what I specialize a lot in. So signs, if you are emotionally avoiding, or if your client is emotionally avoiding, usually looks like anger, difficulties with managing anger, panic attacks, chronic pain that is just not explained by any medical diagnosis, or behavioral reenactments of like acting out angry or acting anxious, just like you did during the time of a trauma. And you can read more about this on the blog post that goes with this video. So we really want to look at emotional neglect and look through that lens of how did somebody learn that emotions were to be avoided? Because at one time, avoiding an emotion was adaptive and was helpful. It was a way for that person to survive. So what question I love to ask people in the beginning is, what's your perception of emotions? If they were a person that you were describing, how would you describe an emotion? And they might say, it's not safe, or it's not useful. And then my follow-up question is, where'd you learn that? And then that's how we get more memories, histories, exploring those attachment figures, if any of those attachments were disrupted. And then from there, again, we always want to make sure our clients have resources before we proceed with any faster bilateral. Resource, I say it all the time. And then my next method that I use is a combination of Jim Knipe's level of urge method, level of urge of avoidance from EMDR Toolbox, from Katie O'Shea's resetting affect procedure, and just based on the structural dissociation model. So I'll ask a client, think of an emotion that's really uncomfortable, or an emotion that you really want to avoid. Pull up an image that goes with that emotion and see as long as it takes for them to really paint a picture. And then on the scale from 0 to 10, 10 being the highest urge and 0 being no urge at all, what is the level of urge to avoid that emotion? And then from there, I proceed with bilateral. So we're doing shorter sets, nothing super fast, medium speed, and we're just trying to get that level of urge down. And then as they're coming up, if they come up with positive information or neutral, we're going back in just like you would with the standard protocol. You go back in, check the level of urge to see if it's come down, and continuing to desensitize. So from there, the goal is to get them down to a 0. It's all based on the AIP model, trying to work through memories that are keeping them perseverating on that avoidance. So we want to work through information that's stored maladaptively. From there, what the whole goal is if we can tone down the avoidance, we're setting them up to have more success with the standard protocol. Because if we want to avoid the affect, the emotions that we felt during a time of a trauma, we know EMDR is based on the 3-prong of the cognitive, the affective, and the somatic. So if we're missing one of those pieces, we're going to have trouble fully reprocessing a memory so that it's adaptively stored where it needs to be. So when we can get that urge down, that level of urge to avoid, we're able to then go in with the full standard protocol so that somebody can really reprocess a traumatic memory or multiple memories. So I hope that that's helpful. If anybody has questions, you can shout me a holler, danacoretta.com. And if you haven't already downloaded my free EMDR handbook, you can go to danacoretta.com/handbook. And it's got lots of information on the 8 phases of EMDR. There's some worksheets in there, some functional MRI, brain scan images. All that's meant to be helpful for use with your clients or useful for you as a client. And again, our practice is Peaceful Living Mental Health Counseling in Scarsdale. We're a trauma-informed practice. So everything that we do is based on that trauma-informed lens. So again, if you have any questions about this or comments, it works, it doesn't work, comment below, and I will see you on the next video. Bye.